You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Welcome to the show and thank you so much for joining me. I'm always happy to have you here and to share my expertise in dentistry and particularly holistic dentistry, where we focus on your health and well-being and how your dental and medical health go hand in hand. If you'd like to know more, then hop on over to holisticdentistry.au. But for now, let's get in the zone. So, as always, I'm going to be focusing on what you can do to have a healthier mouth, to have a healthy life. And I've been doing a series on dentistry without mercury, the impacts of mercury on your health and well-being, how you can mitigate that with supplements, diet, lifestyle, talking about amalgam removal and actually ridding yourself of the mercury-containing fillings in your teeth, and how we go about that. So in this show, I wanted to focus more on the actual protocol for removing the fillings, so that when you are looking to find a dentist who can help you with mercury removal, amalgam removal, that it's done safely and correctly. So let's get started and let's get in the zone. So I'm going to talk about dental office protocols. I'd like to make sure that you understand what the proper protocols are for the removal of mercury amalgam fillings. You've got to locate a dentist who knows about protecting their patients from mercury and does not use or place mercury fillings. So therefore they need to be what we call mercury free as well as mercury safe. And mercury safe is the important one. I would say there's a lot of dentists now who would say they're mercury free. In fact, they don't use dental amalgam, but they're not mercury safe. They do not understand that when you drill on amalgam fillings, it vaporizes and releases mercury vapor that you then inhale. It releases a lot of particulate and dust and splatter that you will inhale, swallow, ingest and absorb. I can't emphasize this point enough. The actions of the dental establishment and therefore the dental profession border on what I would say scientific misrepresentation, and that's resulted in the majority of dentists in general practice having no knowledge or appreciation of the scientific literature on the toxicity of mercury vapor exposure to themselves, their team, and certainly not the patient, which is you. Consequently, neither they or their team, their assistant, their receptionist, the people who work in their practice, the people who are doing this day in, day out, they don't take any precautions to protect and minimise your unwarranted and unnecessary exposure to toxic levels of mercury vapour associated with amalgam removal, and they do nothing to protect themselves. And can you imagine, as a dentist or a dental team auxiliary, you spend 40, 50 years of your career, day in, day out, exposing yourself to mercury vapour. It's not a pretty picture, and I do wonder if that's why, dentists have higher rates of things like depression, anxiety, and suicide. I know there are other factors, but mercury toxicity is really detrimental to your physical, mental, and emotional health. You don't want to have any of your mercury toxicities aggravated. You're going to get some type of aggravation of symptoms during the period of your amalgam removal, but you don't want that to be because you're exposed to mercury. You want that to be, and ideally you want it to be really minimised, not the exposure itself, but yes, exposure, but any aggravation of symptoms buy all the supplements and the dietary things that I've talked about on previous shows. So if you had an amalgam drilled and removed without any safety protocols, you're going to get exposed to mercury and you're going to get an increase in your symptoms. The degree of reaction is going to be very dependent on you and where you're at with your health, but also on what the dentist does and any precautions that they would take. If it's done properly and you are protected and well looked after and supported, and you do your detox with conjunction with a medical practitioner or a healthcare provider, then with all the right precautions, you can have remarkably positive results. I find from my own experience with patients and talking with other holistic dentists, and it's also been documented in research and literature, that most patients will report that their health improves significantly. Now, there are special techniques that your dentist should use to remove mercury amalgam fillings. And if done properly, there is minimum exposure to increased levels of mercury vapor that are caused during and by the removal procedure. I feel it's really important that you should be aware of these aspects so you know what to ask and you know what to look out for. I see these days too many practices say, oh yeah, we can do amalgam removal, and they're not providing the protocols or precautions. Or you go to your general dentist, you talk to them about the fillings, they don't really understand what they're doing, they don't understand why it needs to be done, and they don't take safety protocol, and they may just, go, oh, I'll put a rubber dam on and that way the bits aren't falling in your mouth. But that does nothing to mitigate the mercury vapor. So you really need to do your research and make sure you're well educated. I've gone over this in many, many podcast shows. I've gone over it in videos that I've put on YouTube. It's also on blogs on holisticdentistry.au and also on my work dental practice website, evolvedental.com.au. The information is out there. Make sure you are empowered and that you ask the questions to safeguard your health and well-being. So let's have a look at what these things are and how your dentist should be going about this for you. You want to also look for a dentist who's SMART certified, and SMART stands for Safe Mercury Amalgam Removal Technique. You can find those on the International Academy of Oral Medicine and Toxicology website. So the dental office and the actual treatment room, the operatory, should be well ventilated. So in my room we have two vents. One is the air conditioning coming in, and one is a vent to take the air back out. So we have high ventilation and circulation. We also have a air filtration machine that helps to suction the air and the debris and the aerosol and the vapor that's coming out of your teeth while we're working, and that helps to capture the mercury vapor and all the dust and particles. But first of all, just the treatment room needs to be well ventilated so that there's good airflow. The dentist should have an assistant present. They shouldn't be working on their own. I know some dentists still do that. I can't imagine why. Very inefficient. You need the assistant to be minimizing the exposure, so yours and the dentist and themselves, to mercury vapor. The correct protocol requires the use of high volumes of cold water, both from the drill and a separate irrigation from the assistant, who should be at the same time using a high volume suction evacuation of the vapor and particles resulting from the removal procedure. The requirement for copious amounts of cold water during amalgam removal is well documented and cannot be overly emphasized. Even dentists who are not mercury-free should not know this. Failure of the dentist to be aware of this should be considered a sign of lack of knowledge on the subject. Sadly, some dentists still drill out old amalgam with very little or even no water spray. Now, that's really bad for two reasons. One, without enough water spray, you're creating a huge amount of friction, you're heating up that filling, and you are vaporizing mercury. But not only are you heating up the filling, you're heating up the tooth, and that can cook the nerve and cause a nerve to die. Can't believe, I do get why they don't do it, because, it takes, the patient's going to drown, there's too much suction, it's harder to do, just so many feeble excuses. If you've got a dentist who is unaware or inattentive to this, you should be well advised to seek treatment elsewhere. So what we do in our practice is I have a very high-speed, fast, 200,000 revs a minute electric motorized drill, which is really potent for taking out fillings. We use special drill bits called tungsten carbide that break down and chunk the filling up really quickly. And I have the water up really high, and my dental assistant will be washing onto that filling with the little water and air blower syringe to keep it really wet. So the volatility of mercury means that all precautions and correct techniques should be applied. Mercury vapor pressure doubles with every 10 degrees centigrade rise in temperature. One acceptable procedure that minimises extensive grinding, which generates great temperature increases, involves sectioning the amalgam into chunks versus just grinding it out. So what I do is I use those high-speed drills with the special drill bits, and we cut the filling up into pieces so that we can get it out in big chunks rather than just drill and grinding away on it. So we would also recommend that the dentist ask you to breathe through a nose piece that is attached to a tank of sterile or oxygenated air, and this will permit you to draw air from another area of the treatment room. So you've got a separate air supply. So we use a tank of air, looks a little bit like an oxygen tank or the nitrous oxide, and then we get you to have a nose piece on so that you can breathe through that and have a separate air supply. We use rubber dam, which is a protective sheet that isolates your teeth from the rest of your mouth, and we use that rubber dam during the removal procedure. I say it's absolutely essential, and this stops the bits of amalgam particles and mercury vapor dropping into your mouth and being trapped under your soft tissues, being absorbed through your soft tissues. It means you don't swallow or ingest any of the pieces. If it's done well, then that dam will negate any bits of filling going into your mouth. We use a special non-latex dam because non-latex does not allow mercury vapor to pass through it. At the same time, I use what's called a cleanup tip, and this is like a little cap on the end of the suction that cups around your tooth. It's developed in Sweden, and it goes on the end of the suction, and what we do is we fit that over the tooth, and it applies a constant suction to the immediate work area, and it greatly reduces the extraoral aerosol spray and the possible infectious particulate from going everywhere. That is as well as having the dam. So, and then during the procedure, because me as the dentist and our assistant are at greater risk of mercury vapor exposure than you, the patient, we protect ourselves by putting on special respirator masks that trap mercury. We have nitrile gloves that don't allow mercury to go through them to protect our hands. We wear aprons and hairnets so that we're not getting covered in any dust, and then we use our air filtration machine as well. Now that's called the the IQ HG VAC Pro. We call it Jumbo for short because it has a big trunk, and that is an industrial size air filter that has been designed for hospitals and dental practices to remove pathogens, nasties, chemicals, aerosols, dust, and captures specifically mercury. And that machine has been proven to be 99.999% effective. That means the mercury is not coming up in our face, in our eyes. We're not breathing it in. It's not going up in the room. It's not then being breathed in and polluting the environment. It's not going to land on your clothes and skin. And it really means we can safely protect you and ourselves from mercury. Then all the amalgam bits that are coming out of your filling get caught up in our suction, and we have a special filter on there that catches the large bits so they're not going into the water supply. And we have a secondary filter called an amalgam trap, which means none of the sludge and small particles are going into the water. So we're big on protecting you, ourselves as the team, and the environment from mercury exposure and mercury contamination. Don't be in a hurry. Don't rush to go out there and find somebody. Now, it used to be that 20 years ago, 20 years ago, we were told it was better to replace only a few amalgams at a time with several weeks in between appointments. The research now is kind of flipped back the other way, and we are being educated that it is probably better to get as many out as you can in as short a time space as possible. However, caveat, if you are very sick at the start with mercury toxicity or the symptoms that could point to that, then I would say don't remove your amalgams too fast, because you may get ill or make your condition worse. So in that case, I would be working with an integrative GP, a really good naturopath, getting your supplements in, addressing your diet and your lifestyle, and doing as many things as possible before you start your amalgam removal process to make sure that you've given your body the best starting point you possibly can. Then I would start with one or two of your smaller amalgams and then gauge how you go, how you're feeling, what your symptoms are like, what's happening for you before then reevaluating the treatment plan and the pace at which we're going to remove amalgams for you. You should be aware that once an individual has been mercury poisoned, sensitivity to further mercury exposure will remain probably for life. Often there is also a cross-sensitivity to other metals. In this context, lack of progress may mean you need to re-examine all your actions, like are you still taking all your supplements? Are you being careful about avoiding foods that may contain higher levels of mercury or other heavy metals? Are your bowel movements normal? And are you keeping your dentist and your doctor advised of unexplained or unusual health situations? You must remember that each patient with their own unique biochemical individuality and health history are going to present the dentist with different challenges in determining the best and appropriate treatment protocols. Therefore, the more informed you are as the patient, the better you're going to be able to evaluate and discuss the treatment options with your dentist. Like someone with serious neurological conditions, for example, may require a much different treatment plan than someone who's presenting as fit and healthy and with no serious problems. Unless your dentist insists otherwise, you should kind of look at, if you do have a lot of symptoms, maybe having a 6 to 8 week break in between that first kind of testing, let's see how we go, appointment before then embarking on more. Restricting the removals to a maximum of 1 quadrant, which is a quarter of your mouth at a time, can greatly diminish the risk of increasing and exacerbating your existing problems. Now, depending on how my patients present, how many fillings you have, how big those fillings have, then the guidelines are going to be slightly different. If you've got 1 or 2 small fillings, you're generally healthy. We're just going to get you started, get those out, and be done with. If you've got loads of big fillings, so like say 8 or 9 on each side, upper and, that's including upper and lower, you've got a lot of health symptoms, we might break that down and just do 1 or 2 fillings per appointment. However, if you've got a lot of big fillings and you've got no health symptoms, we may do more. If you've only got 4 fillings on a side, I might do upper and lower. If you've got 4 fillings in your whole mouth, we might do those in one go. There is no hard and fast rule, and it does need to be individualized. It needs to be based on your health, your well-being, and what's actually presenting in the mouth. If your dentist is using a chairside mercury vapor filter system and has a very good exhaust system, whereby the inlet is held close to your mouth to remove mercury vapor and particulate, it is possible to reduce the amount of time between appointments. And this is why things have changed. So previously we only had rubber dam, we had the cleanup tip, and we had an air supply. And so we couldn't capture all the mercury that was coming out during the process. Yes, we could reduce it down to much lower levels than if it was done without those things. But now with the air filtration machines like Jumbo, where we have that right up in front of your face, that's capturing so much mercury vapor and particulate that we can now do more in each appointment, and we can do those appointments closer together for you. We've been having really good results with rapid removal, and that is holistic dentists. And that is done when all the above safe protocols, the safety protocols, are being utilized and the patient can accommodate the planned procedures. So unless your doctor or dentist has deemed it absolutely essential and critical to diagnosis, then you have to have x-rays. So let me just back that up, because I've just jumped and not really explained it. It's really important we get x-rays before we take out your amalgams. There's a few reasons for this. I want to know, have you got any decay? I want to look how deep and big that filling is. Are we close to the nerve? I want to check underneath any tooth-coloured fillings that you may have to make sure there's no residual or hidden amalgam left underneath those. Yes, that happens. The dentist does not clean out all the amalgam and then just fills over the top of it. What I was about to say, if you're pregnant, then I don't like you getting x-rays, and I advise that you don't. However, because now with the digital x-rays that we have, the dosage is exceedingly low, the guidelines have changed to say that it is deemed safe to x-ray pregnant women. Now, I prefer not to, and I would advise against it unless it is absolutely necessary. We certainly wouldn't be doing amalgam removal on you while you're pregnant, and I prefer not to do it on you while you're breastfeeding either, unless you have an emergency and toothache and we have to get into that tooth, and then we would do all those safety protocols and talk to you about other things that we may need to do to support you. Dental x-rays are essential. You need to ask for a lead collar, what's called a thyroid collar, or a lead apron to cover your thyroid. There's documentation that demonstrates that extremely low doses of radiation are harmful to the fetus. So again, I just want to be super careful. I want to make sure we're doing the right thing by you. Now, one question related to the amalgam replacement is, this protocol called sequential removal. Now, this was really big back in the 90s and the early 2000s, where dentists would measure and chart the electrical current of each filling and remove or replace the amalgam fillings based on this information, started with the highest negative readings first. And a lot of holistic dentists was doing that. I mean, it was a great thing. You could say to people, oh, look at that. You've got a huge electrical current in this filling. Yes, that's not a great thing. And then, oh, we're going to do it this way. It's really scientific. And patients are like, oh, wow, this is amazing. But the truth is, there's actually no scientific data to support the use of this sequential removal. There used to be all this stuff of, oh, you must do the one that's highest first, otherwise the patient's going to die, you're going to make them really sick. Oh, and don't cross the midline, don't do the right side and then the left side, because that's a real no-no. There is no science behind that whatsoever. This is one of the things, somebody says something in dentistry, everyone goes, oh, that sounds like a good idea. And like sheep, they all follow and they don't do their research. So there's no scientific data to support the use of sequential removal. There's absolutely no scientific data to support the statements that were made saying that if your dentist doesn't use sequential removal, it will cause mercury to be locked into the tissues. That is just not true. It has been well established scientifically that precise measurement of the electrical currents or comparison of the electrical currents emanating from various amalgams is not possible. So yeah, I can read the current, but it's not going to be accurate. Amalgam is an unstable material to start with, and measurements are of specific points on the filling and not the entire filling. And therefore, they just can't be relied upon and they can't be compared to each other. Now, electrical currents from fillings in the mouth do result in the movement of metal ions, and with resulting deterioration of the filling, the release of mercury from that filling can also cause pain. Let me just say that again, because I don't think I got that across very well. So you get the electrical currents and that moves ions from the filling. That results in the filling deteriorating and break down, and that increases the release of mercury from the amalgam. And as the filling starts to break down, that electrical current can also cause pain. Although the electrical current of one filling cannot be immediately compared to that of another, the severity of electrical charge of individual fillings can be determined. To do so requires determination of a combination of the electrical factors, which are the voltage and the current flow from one point to another. And we used to do that. It was a lot of fun, but I don't do it anymore. I just don't see the point. Basically, if you've got amalgam fillings, they act like little batteries in your mouth. They're going to have electrical currents. They're going to be releasing mercury. Why do we need to test that? I don't know. We should just say, look, you've got an amalgam filling. It's going to be releasing mercury. We should get that taken out and removed safely for you. The simple truth is that most dentists around the world are replacing amalgam fillings with non-metallic fillings by quadrant, usually starting with the quadrant that has the largest fillings and thus removing the largest source of mercury first. The results achieved with removal by sequential removal cannot be distinguished from those achieved with quadrant removal. Therefore, if your dentist has the equipment and wants to replace your amalgams fillings sequentially, there's no problem in doing it. It's not going to be bad for you. Just bear in mind, you don't have to have it done that way. There's no prerequisite for that for successful amalgam removal replacement. And look, one thing that concerns me, and I don't want patients to go through, is why have more visits than you need? Why be injected in the same part of your mouth several different times if you don't need to? Why do one filling on the top right because that had the biggest current, then do one on the bottom left, then come back to the top right, then go back to the bottom left? That just doesn't make sense to me. It's not practical. It's not an efficient use of everybody's time. It's not the best way to treat your mouth. Can you imagine how sore you're going to be just constantly having the same area worked on over and over? Makes sense to me. If I'm going top right and you've got 3 or 4 fillings that all go numb on the same injection and I've got the safety equipment out, we work on that side. Unfortunately, there is a fee that you have to pay every time we use the safety equipment and safety protocols because of the materials and the time that it takes. And if I can minimize that fee by charging it once for a section of your mouth, I can save you some money, I can save you time, and we can get the amalgams out efficiently and effectively. Couldn't say it, but I can do it. One other aspect of this oral electrical phenomenon deals with having a gold crown, inlay or onlay, which is a gold-made filling, that is making contact with an amalgam filling. When you've got gold against amalgam, this causes an increased release of mercury vapor and accelerated corrosion of the amalgam filling. Gold can be effective in a negative way because the gold actually absorbs mercury vapor. Therefore, if this condition exists in your mouth, the dentist may want to correct it first by replacing the gold fillings. Let me just make that very clear. The amalgam fillings that are in contact with the gold. So you may have a gold crown, you may have a tooth either side where the fillings touch against that gold crown, and you may have fillings above or below that crown when you bite together that they touch. And that may be where we want to start. I normally start, if no one's got gold, I normally start with the biggest fillings first. Get the most volume out first. Or if it's predicted by the tooth, you might have a crack that needs treatment. You may have decay. The filling may be broken. I would start with those. I'm going to get you out of pain, get you comfortable, deal with things that are going to advance and cause damage or destruction first and foremost. So you need to make sure your dentist is SMART certified, that they're using rubber dam, using a cleanup tip or high vacuum suction, or they're using copious water spray, the room is well ventilated, you're getting separate air supply through a nose piece, that there's an air filtration machine with a capture trunk that's going to be used close to your face, and that the dentist and the dental assistant are wearing mercury respirator masks and protecting themselves as well as you, and that they understand the impacts of mercury toxicity. And if you have all those things, if they can help you with your supplements, some can't prescribe because they don't have the background in nutrition and environmental medicine, or they're working with a naturopath or integrative GP, then you're going to be in the right place. If they don't do all those things or you don't feel confident, then don't go ahead. Take your time, do your research, and go see somebody else. I would rather you spend your time and your money on a consultation and then decide it's not for you than spend your time and money getting amalgam removal done and not having it done safely. So, I'm Dr. Rachel Hall. This is the Dental Zone. Thank you so much for joining me today. I hope you found this useful. I know I have talked about this before, but I can't stress enough how important it is that you get your amalgam done properly, because there's too many dentists out there who don't fully understand the implications of mercury and amalgam removal. If you want to know more, hop on over to holisticdentistry.au, or if you want to come see me, you can give us a call at Evolve Dental on 0737201811. But for now, until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.